Hi, I'm Haley Selleck, nurse practitioner at First Responder Health and Wellness, and welcome to 5 Minutes to Better Health, a short educational mini-series specifically designed for first responders. The intention of this series is simple: to give you clear, practical health education that you can apply immediately without needing hours of research or guesswork. In these episodes, we're going to cover the foundations of health that are often disrupted in first responders, including sleep, stress, hormones, nutrition, movement, and long-term performance. We'll also talk about how chronic stress impacts the body over time, and how targeted testing and individualized care can change outcomes. Each episode is designed to be about 5 minutes, focused, evidence-based, and actionable. This is not about quick fixes or biohacks. It's about understanding how your body responds to the demands of your job and learning how to support it more effectively. Whether you're currently a patient of first responder health and wellness or simply looking to take better care of your health, this series is meant to meet you where you are. First responders are held to a higher physical and mental standard, but the healthcare system doesn't always meet you where you are. First responders are expected to function at a high level in unpredictable, high-stress environments, but most healthcare systems are not designed for the realities of your job. At First Responder Health and Wellness, we are a telemedicine practice built specifically for first responders. Our approach is comprehensive, data-driven, and individualized. We don't practice one-size-fits-all medicine. Instead of reacting to symptoms, we look for root causes. We use standard and advanced laboratory testing to evaluate things like hormone balance, stress response, inflammation, nutrient status, cardiometabolic risk, and sleep-related physiology. Then we build a plan that integrates lifestyle, nutrition, movement, sleep, targeted supplementation, and medication when it's appropriate. One of the first areas we address with almost every patient is sleep, because sleep impacts everything else. Sleep is not a luxury. It is not a reward. It is a biological requirement. For first responders, sleep is often fragmented, inconsistent, or sacrificed entirely due to shift work, overnight calls, rotating schedules, or high adrenaline states. Over time, inadequate or poor quality sleep increases injury risk, worsens mood and cognitive performance, disrupts hormones, and significantly increases cardiometabolic disease risk. Even when you're sleeping, your body may not be recovering. This is where stress hormones, especially cortisol, begin to play a role. Cortisol is meant to follow a daily rhythm, higher in the morning to wake you up and lower at night to allow restorative sleep. In first responders, that rhythm is often disrupted. We'll go much deeper into cortisol in the next episode, but it is important to understand that sleep and cortisol are tightly connected. You cannot optimize hormones, metabolism, or performance without first addressing sleep. The good news is that even with shift work, there are practical steps that you can protect your nervous system and improve sleep quality. Here are several evidence-based sleep hygiene strategies that I recommend regularly in clinical practice. First, protect your sleep environment. Your bedroom should signal safety and recovery. Keep the room dark, cool, and quiet. Use blackout curtains or an eye mask, especially if sleeping during the day. Minimize noise with white noise if needed. Second, be strategic with caffeine. Caffeine has a long half-life. Try to avoid caffeine within 8 hours of your intended sleep time. Using caffeine to compensate for chronic sleep loss often worsens cortisol disruption over time. Third, create a wind-down routine. Your nervous system needs a transition from high alert to rest. This can be as simple as dimming lights, avoiding screens 30 to 60 minutes prior to sleep, stretching, reading, or taking a warm shower. Consistency matters way more than perfection. Fourth, anchor your sleep schedule when possible. Even with shift work, aim for consistent sleep and wake times on off days especially. Avoid large swings whenever possible, as irregular schedules really worsen the circadian rhythm. Fifth, support sleep nutritionally. Underfueling increases nighttime cortisol. Avoid going to bed hungry. A small protein-containing snack can be helpful. Magnesium supplementation may support nervous system relaxation for some individuals. Finally, don't normalize chronic exhaustion. If you're sleeping but not recovering, or if insomnia persists, this is often a sign of deeper hormonal or stress dysregulation that deserves evaluation. At First Responder Health and Wellness, we view sleep as the foundation of performance, resilience, and long-term health. In the next episode, we're going to dive deeper into cortisol, how chronic stress alters hormone imbalance, why first responders are especially vulnerable, and how we assess and address it using targeted testing and individualized plans. If you're a first responder who wants healthcare that understands your job and treats the whole picture, this is what we do. To learn more, go to our website at firstresponderhealth.net.